Women who have low ovarian reserve in particular, they have low number of eggs. They need less dose of medication, and pills is enough to grow those follicles. I'm going to give you an example.
Hi everybody, it's Claire with FertilitySpace. I wanted to jump in really quickly just to give you a preface to my conversation with Dr. Merhi. So Dr. Merhi is a fertility physician in New York City at Rejuvinating Fertility Center, and he provides a lot of really interesting alternatives in conjunction with IVF for fertility patients, specifically that have poor egg quality or diminished ovarian reserve or primary ovarian insufficiency. So I thought that you might find these alternative treatments really interesting because he's seen really good outcomes with his patients as far as improving their egg quality. First, we started off talking a little bit about needle-free IVF. So at his practice, you can actually do an IVF cycle without having to use any needles. So no injectables, no blood draws. So I thought that was really interesting. So he explained how that works and why some patients want to do that, primarily for patients that really don't want to deal with needles. It's a good alternative for their IVF cycle. We also talked about mini IVF or minimal stimulation IVF, where someone would use a lot less fertility medications than what is typical in a conventional cycle. Oftentimes he uses this for patients that had poor egg quality or a low ovarian reserve. So it's cheaper, but also he's seen really good outcomes with patients that have had poor egg quality in previous conventional IVF cycles. So I hope that you find this helpful and that you get something out of it.
First of all, thank you so much for having me. I hope will help more awareness regarding infertility and help more people have children and freeze eggs and everything like that. So as far as the IVF, in conventional IVF, patients usually take 2, 3 shots per day, right? For like 10 days or so. I do a lot of gentle IVF or mini IVF, which is basically combination of pills and injections. However, a lot of people are scared of injections or they might not need them either. So I only focus on pills in order to grow the follicles. Women who have low ovarian reserve in particular, they have low number of eggs. They need less dose of medication, and pills is enough to grow those follicles. I'm going to give you an example. If you and your partner, each one is a follicle, right? I want to, the medication, the shots and all those are food for those, for you to grow both of you, right? If I cook for 2 people and give you the food, you'll be happy. If I cook for 10 people and shove it in your mouth, you're gonna vomit. So really, give them what they need. And Clomid and Letrozole, which are pills, they're enough to feed you and your partner. It's enough for 2 people. Why do I need to give you shots? So no matter how much medications you give, it's not going to create a new follicle or new egg. I cannot create new person by just giving you a lot of those. So what I'm trying to say is the following. We look at the number of follicles or the reserve. The lower the reserve, the less the medication. You reach a point where pills are enough and you really don't need injections. However, I have phobia from needle, okay? Believe it or not, yes, I'm a doctor. So you know, if you have a lot of follicles, needle-free without any injection might not give you the same outcome. You might get less number of eggs. Why? Because the food that I'm giving is not enough for all of them. So if you are 10 people in the family in the house and I cook for 2, a lot of people, only 2 people are gonna grow, not 10. So giving more food would be better. I don't know if I'm making sense. I like food, so all my comparisons are food. They actually can grow up to 7 to 8 eggs, Clomid and Letrozole. Remember, they're pills that you can give 1 pill each up to 3 pills each. So if I give 6 pills per day, 3 of Clomid, 3 of Letrozole, I get, and we've published that. We've published that. It's not something, you can get up to 8 eggs. Actually, look, there is a lot of studies. I mean, and I do believe what I see it every day. Even women above 40 who have, their eggs are fragile. Even if they have a lot of follicles, you shouldn't really pump them with a lot of gonadotropins, because it's like you're pushing someone on the face to wake up, and it hurts them. Look, when you and I were baby kids, we would fall on the floor, we bounce back, right? Now, if I fall on the floor, you need to call 911 to pick me up. So what I'm trying to say is our body is not the same, and the egg becomes more fragile, and this gonadotropin shots, bam, 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 is way too much. And there is data, everything I'm telling you, there is data behind it. There's data showing that the higher the dose of medication you give, the worse the egg quality. Absolutely. A lot of time I avoid completely the injectables. The injectables are non-organic food, if you want to call it. Let me tell you why. The pills work through the brain to increase your brain hormone, the FSH and LH, to feed the follicles. The brain FSH hormone, or the brain gonadotropin, is not only one type, it's actually multiple types of gonadotropins. We call them acetylation or glycosylated and acidic and basic. So many of those are going into the blood system to bind on those follicles and eggs. But the gonadotropin you take in the pen is only one type. So it's not multiple types of gonadotropin. So yes, the quality tends to in some patients tends to get better if you avoid the injections. And look, Claire, I always tell people the first baby in the world was natural cycle. That's how it started 46 years ago, zero medication. So now I feel like, yes, we're giving medication. We started pills and shots, and now I think we went too far. I really do. Look, everybody's different, right? So we do here natural IVF. There are people who cannot even take anything, medication. If someone is sensitive to the drugs or allergic, or they have medical problems or some types of cancer, you cannot give them. We do natural cycle, right? We do now more. We increase to the pills, right? Like now then pills plus shots, then shots, 2 shots. So we do all kind of spectrum. And I really think patients are not one type. Patients ask me all the time, well, why are you giving me different protocol than the last cycle? Because your body right now is giving me different number of follicles and different number of FSH. I can't treat the same thing. They're different. You had 12 follicles, now you have 8. I can't give the same dose. There's less people to feed, give them less. The same. What I do is I give Clomid and letrozole. Letrozole, I stop it after 5 days, and I continue Clomid all the way till the end. Continue Clomid up to 14 days. In summary, the needle-free IVF, you take Clomid, letrozole. At the end, you give Orilissa to stop ovulation. Orilissa is similar to the Cetrotide and the Ganirelix. It's a pill. It's much cheaper. It's used for endometriosis, and we got a patent for it to use it as suppression for the ovulation. And then you trigger with nasal spray. That's in summary. Correct. So there is a lot of patients who are scared of needles and blood draws, and sometimes a lot of patients, they have difficult veins, right? They're dehydrated. So instead of sticking them with a needle and 10 times to get blood, you can really test those in the urine and the saliva. But you shouldn't brush your teeth or eat anything in the morning before you give the saliva, or it's not accurate. Okay. And it has to be the first urine in the morning. If you do that, it's as reliable as the blood. Usually they do it at home because you want to brush your teeth in the morning. So you just give the saliva and then you drop it. The saliva, we test the estradiol and progesterone, and the urine FSH and LH. Remember, the urine ovulation kit measures a LH surge in the urine. It's like the same thing. You technically can just do the ovulation kit. We are monitoring for, if you want to monitor for ovulation, because in IVF you're stimulating, but also you want to make sure patient doesn't ovulate. Right. We do urine ovulation kit. If it turns positive, call us and let us know it's surging. Then we'll bring you earlier for the egg retrieval.
So someone had a question about mini IVF. So she said, I had 4 follicles during conventional IVF. Would mini IVF produce fewer follicles?
No, the follicles is you're spending, this is the cash you're spending this particular month.
Okay.
Medication does not create new follicles, as we discussed earlier. So all you need is to grow those, give them what they need. Do not overfeed them. So for this person, I will avoid injectables completely. You're going to get 4 eggs this month, no matter what you do. Even if I pump you with 10,000 units per day, it takes 90 days for a follicle to show up on ultrasound. 90, 3 months. So pumping your drugs for 10 days of stimulation is not going to create new follicles.
So when you are looking on the ultrasound, are you counting how many antral follicles someone has to know how many you would be able to recruit for an IVF cycle? Or how do you know how many you would be likely to get?
Well, you do an ultrasound at baseline, right? So when the patient gets her period, we tell them come on the second or third day. Sometimes we give them birth control pills for a week or 10 days, or estradiol or patches, and we then tell them come for monitoring. That monitoring or blood and ultrasound is their baseline. I see how many follicles, and then I give them medication. That's why it surprises me how, I mean, how some people give protocol just by meeting the person. I don't know until I see what your body needs, and I'll give you what it needs. That's why it's very individualized IVF stimulation based on every person.
Right. Makes sense. Okay. So it's all about what you see on the ultrasound and then you kind of tailor it.
Exactly.
We have one more question, and this one is about needle-free IVF.
Sure.
So she asked, can you have this if you have a low reserve? She had 2 failed ICSI cycles and tight funds available. She's concerned about whether she can do needle-free IVF if she has a low ovarian reserve.
Yes, and needle-free IVF, as we mentioned earlier, is actually it's the answer for your pocket to save you money. And because look, I see people being pumped with tons of drugs and they develop one follicle. And I say, listen, if you did nothing, you would have developed this follicle. That's what does naturally. So what's the purpose of all these? This is the most expensive follicle, $5,000 follicle. Don't do that. It's actually bad quality. So a lot of people don't even develop anything because the system shuts down. So she's actually a perfect candidate for the needle-free IVF or the pills, the home IVF kit, if you want to call it. And really, she would save a lot of money with the same outcome, in my opinion.
When someone does have a really low number of eggs retrieved, I know it depends on the doctor, but some people recommend doing ICSI just to make sure that essentially a sperm gets into the egg to give it a chance to fertilize. With your patients, do you just do conventional IVF? Does it matter?
So ICSI is not, women with low ovarian reserve is not an indication for ICSI. You don't want to manipulate the egg too much. ICSI can be aggressive, especially if the embryologist is not experienced. So ICSI is done for egg that's frozen because the shell gets hard. For the sperm is frozen because the shell gets hard. For previously failed fertilization. Done for someone who has a very low sperm count and poor motility and morphology. But it's not really indicated for women with low ovarian reserve. And you'll be surprised that sometimes conventional way, just add the sperm to the egg, could do better than the ICSI. But again, it's case by case basis. I can't just generalize. If she had failed implantation, failed fertilization with the conventional way, then ICSI is indicated. Otherwise, I don't see a reason why you need to do ICSI.
Do some people sometimes do IVF with you remotely? I think I read that if people wanted to work with you, they can be in their own state if they're not in New York or Connecticut, but they could work with you?
Yes, so 40% of our patients are actually not in the New York State area. They're outside the area and also all over the world, including Hong Kong, Europe, Caribbean, Canada. We send you our protocol. We do everything. You only come to us once the day of the procedure or the egg retrieval or the embryo transfer or whatever it is. We send you the prescription to monitor. All you need to do is to go any place close to you, any OBGYN doctor, a fertility clinic next to you, even a hospital. Just say, I'm doing IVF, I just want to do these results. They will do the tests, and the form that we send has all the instruction on how to send us the results. We get them back. I make a plan. Blood and ultrasound are really simple, can be done anywhere, right? The ultrasound can be tricky, but the blood is really simple. They're all similar machines. They're very reliable. I can make plan on just blood sometimes only. So, and then we will manage everything. We will tell, the staff will tell how much to take, what to take, when to trigger, all that stuff. Then you need to come only the day of the procedure. So yeah, it's very simple, very convenient.
Awesome. And then what is the best way for people to find out more about you and your clinic and the sort of treatments that you offer?
Sure. So our website is Rejuvinating Fertility Center. My name is Dr. Merhi. And if you go to our website under our services, you'll see a lot of novel things that we do, under our services. If you would like to contact us, you can go to on the website, contact us, and then fill your information, and someone will call you right away. You're also welcome to send me DM me on Instagram, Dr._Merhi, Merhi, or on our Rejuvenating Fertility Center Instagram account.
Perfect. Awesome. Yeah. And I really like your guys' Instagram, by the way. You guys do great TikTok dances and things as well.
We did it yesterday, so I hope you like it.
Oh, I'll have to check it out. Well, thank you for your time. I really appreciate it.
Thank you so much for having me, Claire. I really appreciate your time, and it was fun.